So we are back, ladies and gentlemen. I would love to know, like, if anyone would like to speak. We only have a few minutes, and then we're gonna wrap things up. Let's talk for 5 minutes, and then we're gonna do a small wrap up at the end. All right. So who would like to go first? Which group would like to go first? Let's talk about just one thing that resonated with you, so we can hear from other groups. Yes, I see some. Okay, Shamika, go ahead.
Well, so what resonated with us, we were just talking and I wasn't even aware of Mr. House's program providing internet to areas that didn't have it. And I think at least for me, like the issue itself kind of exasperated for me, or I became aware of it through the pandemic, which a lot of things kind of came to the forefront that maybe had always been there, but just the pandemic made it a lot worse, was access to internet. So I wasn't aware how big of a problem it was until the pandemic. And students had to work remote and people were working remotely from home, and that's when I realized how big of an issue internet access was.
Ooh, I would like to jump in and respond, because that was one of my little, anger moments with my own peer group where we talked about digital classism right earlier. We did a fundraiser for our project, and I was like, pubbing, putting on pages, sending out emails, asking for it. And this was before the pandemic. And so we raised about $8,000, $10,000. And I would say amongst my peers, there were some people that came through, but most people kind of fluffed it off like, why? We got the internet. Why are they asking for money? What is this? Everybody's got the internet, don't they? They got phones and computers and laptops and tablets. We didn't realize to the pandemic how not only were we short on devices, but also short on bandwidth to carry all these people having to interact. So just those were examples of where the classism was exposed, because everybody who had high speed at their house was like, oh yeah, I got it. And not really with arrogance, but with comfortability. Part of what privilege comes with being able to afford it.
Yeah. No, it was definitely ignorance. It just, like you say, you just assume, hey, yeah, we have it, or people are on social media, like, people have the internet, and that's kind of what you thought.
I think too, back somebody in the talk too, we talked about devices and how important that was. Devices that are up to date. Use of the devices, I guess, first as a fundamental, but even more so, how devices, wow. There is a separation, because things like doing a term paper on a phone or even on a tablet is not the same as doing it on a desktop or a laptop, where you have presentations or artwork, graphics, anything that you do with computers. The phone can do that, but your landscape or your canvas is much smaller. Therefore, you won't be limited in how effective you can be. So just
Thank you, Mr. House. We're gonna go to Lisa and also Dr. Wade. Did you have your hand up, Dr. Wade? This last two, and then we're gonna wrap it up. I am so sorry, guys. I do want to be respectful of your time. Thank you.
Just a couple brief notes. One thing that came out of our group: how do we teach safe, healthy internet use, skills in evaluating the information, safety, protecting people from scams, especially with vulnerable populations, how to engage with the internet in a way that's healthy and not just creating more of a burden on people that are already stressed. Money spent on internet access by nonprofit organizations in particular, or organizations that are working on food access. When they're spending money on internet access, then they can't spend that on food access and other programs. And so, is there a way to get them connected more inexpensively? And what do we need? How do we help other organizations start programs, fundraising, education, grant writing support? Thank you.
That was pretty thorough. Thank you so much, Lisa. Wow, these are some great points. Dr. Wade, you want to close us out a little bit?
Just wanted to add one piece of information that surfaced in our breakout group. An initiative that Connect 313 it has underway currently is this launch of a broad neighborhood tech hub network. And so, House, I definitely want to follow up with you later about this, but I just wanted to let you all know that I had put the link in the chat, and I can do it again for those who maybe I wasn't sure if it was only our group that could see the chat at the time, but this is a list of all of the community partners that Connect 313 is helping to support with funding, resources, and a little bit of programming support to bring high quality devices, high quality, high speed internet to neighborhoods. We have a vision that we want access to be within 10 minutes of all Detroit residents. And so we want to grow this network, but this is where we're starting. And so the link will show you all of the locations. The 17 that were announced this past summer at the Rocket Mortgage Classic will go live probably at the top of the year. They're doing their onboarding now. And so I can, answer any follow-up questions about that, but just wanted you all to know that this is a big initiative that's underway and in a way that we can try to work together to connect and help our residents. We can collaborate together to help connect our residents. Thank you.
Thank you so much, Dr. Wade. Guys, I just want everyone here, just thank you for coming. And I'm going to get Dr. Thompson to close us out with her last words here, and thanking you again for attending all 3 workshops. Is this your first workshop? Fine. We just thank you for spending time with us. Dr. Thompson.
Thank you. Can everybody hear me okay? Cool. So, one of the things, as I've been over the past few years doing this kind of work, directing efforts more towards community engaged research and working with my colleagues at Wayne State and beyond to do this, is that everything is based on relationship, right? And there's a purpose to us even over these 3 days, seeing each other on an ongoing and talking with each other, and to putting us into smaller breakout rooms so we can have more focused conversations to build relationships, to build understanding, because that work that we want to do in terms of thinking about the social determinants of health and having real impact on health in our region has to start from those relationships. It has to start with partnership. And not just partnership between Wayne State University and community organizations. I'm loving that the community organizations you're, Dr. Wade and House, you're connecting with each other. That's what we want to do. So again, this is not the end, this is the beginning. Please contact us if you'd like to continue thinking about these issues and working on these topics. Thank you for joining us today. And next week, I'm going to turn over, thank you. First of all, thank you to all the speakers. Thank you to the planning committee. Thank you for everything you've contributed. It's been an amazing 3 days.